In our panel session on this Monday, we delve into ongoing efforts here and elsewhere to contain COVID-19 as we adapt to a new normal. For more, I have Professor David Kwak from Suncheon University. Welcome back, Professor Kwak.
Good afternoon, Sunny.
I also have Dr. Kim Seung-taek from Institute Pasteur Korea. It's a pleasure to see you again, Dr. Kim. Professor Kwak, we'll start with you. It's been 2 weeks since the start of Korea's exit strategy, and the number of severely ill COVID-19 patients has been on a persistent rise. How do you assess the situation on the local front?
Well, let me begin with making a little different statement here, that I don't assess the numbers in the ICU beds actually is a continuous rise. Rather, it's fluctuating. As I mentioned before, the number of ICU beds that are being taken, it sort of fluctuates, and it's not completely a true representative of what's happening now. It's usually an accumulation of what's happened before about prior 2 months or so, because people don't necessarily get severe right away from the point of time that they get infected. So we can pretty much say, we can sort of anticipate the people currently being in the ICU beds to be from those who were infected probably a month or 2 months ago, or even some of the cases, in rare cases, they could have been infected very recently as well. But I also want to iterate the fact that it fluctuates because over the weekend, we started going into the weekend by having the number at around 485. And as Seoul reported today, it's gone down to now, I think, 471. The government is currently stating that they would take into consideration and possibly go into a different mode once we hit a 75% of the fill-up of the ICU beds before we begin processing the plan differently. So we're really playing with a cup that's about 2/3 of a full. But the huge difference is that we can either add more water into it or take out water into it depending on the situation. We have to keep the number low, obviously, but we should not be completely panicked just because we've hit high 400s of the number currently. What we should instead do is focus on how we would maintain that even lower than currently, but we should not be completely panicked just because we have higher 400s of the numbers currently.
Right. And against that backdrop, Dr. Kim, what are your prospects of the launch of phase 2 of Korea's exit strategy come mid-December, given the current COVID-19 situation?
Well, the sort of just living with the COVID-19 goes some stepwise manner as we just said, and then we are currently on the phase 1, and then the transition to the next phase is not really just automatically. We actually just evaluate the current situation and then the effect of the easing some social restriction, and basically the 4 weeks of just running the new phase and then followed by the 2 weeks of the evaluation of such the easing of the situation. And then actually, one of the main just the parameter that we actually judge regarding the transition is the number of just the beds for the severe COVID-19 patient, as Dr. Kwak said. And then one of the actually the aims of the transition just for this living with COVID-19 is that actually we actually evaluating each different parameters of just social restriction measures. The parameters is the first one is the business hours, and the second one is the number of participants in the private meetings, and then the third one is the restriction on the certain business operations. But somehow in the phase 1, we somehow just all of these three are somehow just a little bit just eased on. So then the problem is it's not really, so now it is a little bit just difficult to just judge which actually factor actually just the affects more just significantly than those others. So that's kind of just a concern among some of the experts in all those quarantine measures. So basically, the current situation just might be, there's some chance of just maybe just maintaining just some stable level, like just a 400 or like less than 500 levels, and also maybe just to go up just above the 500. We will see, but then the number of the beds available would be just the main just determinant whether we go for some next phase or not.
Right. And staying with the response from the medical arena, Professor Kwak, how is the medical system here on the local front coping with the surging cases of serious illnesses?
Right. So to the best of my knowledge, I think the government is currently noticing that we could probably handle up to about 500 or less of the ICU beds filled up with much ease. But they're also, to the best of my knowledge, over the weekend, they've requested private sector hospitals to increase the number of ICU beds that they can provide. So they're hoping that with higher numbers of capacity, we'll be able to have a buffer zone, so to speak, to handle even further higher up numbers. But that's from a personal, medical doctor's point of view. That's not entirely the picture that we should have in regards to ICU beds, because it's not just the physical numbers of beds that can provide the service, but rather we also need specialists who can take care of these patients while those people are in the ICU beds. So that's one of the most concerning factors to me personally, being a medical doctor. But also I see this picture wholesomely in a different way. As I said, the numbers of ICU beds capacity fluctuates depending on how many incidents of cluster infections in the elderlies we have during that time. But also further going on, I think with the higher implementation of vaccination rates, especially among the elderly people and with underlying diseases, I think there's also a great chance that we might even decrease in the ICU beds fill up in the future, since we have higher number or higher rate of vaccinations from those people who are more vulnerable to the disease or severe progression of the disease. Number two, it's very likely that we'll have a completely new regimen of treatment become available sometime in the near future. Let's say if that was to happen, let's say 2 to 3 months later, from that point on, we might even see even further lower numbers in ICU beds, because those drugs are meant to come into place early on in the phase of the disease. Also, number three, this is my rather personal suggestion. Currently, I think private sector hospitals treat people who are either moderate or severe in the progress according to their own decisions. There is no set of protocols that is equal to throughout the nation. So most of the common pictures that I noticed is that rather these doctors, us being medical people, because we have to take responsibility for how we treat them, they start treating certain group of people much later on in their progression of disease rather than earlier in the phase. Number two, they also decide to treat with those regimens only for those people who are more vulnerable, such as those who are elderly or with underlying diseases. I think the government can possibly, let's say, request from a committee of specialists to make a formal protocol for the nation to take, so as to take more aggressive approach to the patients all throughout, much early on in the progression of the disease. So for example, if we were to take start giving out treatment regimens such as remdesivir or monoclonal antibodies, which we have in hand already, to the people who are even younger in ages. Let's say those people who are 40s and 50s, maybe with hypertension, maybe with diabetes, rather than only limiting that to people of 70s and 80s, then we would also be able to see much less numbers filling up in the ICU beds, because it can possibly stop the progression of the disease much early on. So that's only my personal suggestion, though.
Right, but it is a valid point right there.
I would hope so.
Right. Dr. Kim, recent findings show 1 out of every 3 new patients involves a person aged 60 and above. Now, having said that, the government, of course, is calling for the importance of booster shots. Aside from booster shots, what else do you propose to deal with the rising number of cases among those who are older? Well,
as you said, the booster shot might be just probably the best one that we actually come up with right now. And the second one is actually just some strengthening some restriction measures for certain some age groups. For example, like some regular PCR test for just people working in the some nursing hospitals, and also some for some visitors as well. And then also, as Dr. Kwak said, maybe you can also implementing the widening, the more wide use of monoclonal antibodies as well, to basically decrease the number of severe COVID-19 patients.
Right. Now, containing COVID-19 remains a priority not just here in Korea, but also in Germany. Authorities there are battling a resurgence that pushed the daily tally to over 50,000 cases last Thursday. For more, I have Jan Rubel live on the line. Rubel, it's been a while. Jan, it's been a while. That is, welcome back.
Yeah, thank you.
Right, Jan.
Good to see you again, Sunny.
It really is, Jan. Now, here, there has been a retreat in the daily tally today since last Thursday's alarming figure. Do start with the overall situation there in Germany. And Jan, do tell us a bit about the reasons behind the recent rise in infections there.
Well, the incidence is rising strongly. And, we had a calm summer, everybody felt relieved. But then happened what the scientists had already predicted a long time ago. And now we saw in the last 7 days 303 infections per 100,000 infections. And of course, this puts a lot of pressure into the system. And we have now more than 3,000 people in the intensive care units. And this means for other patients that a lot of other surgeries have to be postponed. Even some patients have been flown out to Bolzano and Merano in Italy. And this is, of course, a difficult situation. I mean, until now, the hospitals give us a notice that it's still under control, but soon they will reach the limit. That is pretty sure.
I see. Jan, at least 67% of Germany's population of 83 million is fully vaccinated, and there appears to be little change in that rate itself. Now, is vaccine hesitancy still an issue there? And if so, how are authorities in Germany seeking to address it?
This is our main issue because, most of the infections we are facing now are with the unvaccinated. And until now, we have 68% in Germany who are fully vaccinated. But it is simple. We didn't reach the critical mass of vaccinated people in Germany in order to curb the spread of the virus. And the problem is, of course, who is until now not vaccinated doesn't want to be vaccinated. So the question is how to reach them, how to convince them. And yes, the government is promoting vaccinations, of course, but not massively, because we are in Germany, the politics is in a kind of a limbo now. We had elections in September. The old government is only managing. The new government is still not in power. And this keeps us all in a vacuum. And nobody knows how to proceed now.
Right. And talking about the unvaccinated, Jan, neighbouring Austria has reimposed movement restrictions against the unvaccinated, while the Netherlands has reintroduced a partial national lockdown. What options are being explored by Germany then?
Well, until now, there are no lockdowns being planned. But as we see the situation now, it can change very fast. I could imagine a lockdown just before Christmas, by example, or that we will have to see installed the so-called 2G reglement in Germany, which means that only vaccinated or recovered people get access to certain institutions or services. A harsh lockdown like we are going to see in Austria, I don't see this happening in Germany unless the figures become really catastrophic. And how to go on now, this is really difficult to forecast. I mean, of course, we know we need some pressure, but it's in Germany like in any other country. You ask 2 Germans, you get 3 answers. And when you ask me personally, I think we spent a lot of time trying to convince people. Now it's time to act. Now it's to put some pressure into act.
Jan, do you see perhaps a change in testing options over in Germany to encourage people, to better keep track of infections there?
Yes, of course. The new government promised to continue or to re-continue with testing. But I am asking myself, I'm not an expert. I'm writing about politics. But I'm asking myself, what can tests help now in this situation? Only vaccinations can help, because nobody knows if these tests are working really, really good unless they are PCR tests. But these are not the tests we are talking about in Germany. So I think testing is a nice maneuver for not doing nothing.
Right. What about the academic arena, Jan? Is that being left open, given the potential risks exposed to teenagers who have yet to be vaccinated in Germany, right?
Yes, people above 12 years, they can be vaccinated, and until now schools are open, and this is what the government is giving as our message that the schools shall remain open until the last thing we are going to stop. But the situation is now difficult, and we will see what's going on. You know, since the beginning of the pandemics, in the first and the second lockdown, the young ones, the students, the pupils, they were the first ones to suffer. And now there is a promise that they will be the last ones to suffer due to restrictions, but I'm not so sure if the government really can help this promise.
Right. Moving on, Professor Kwak, the European Medicines Agency recently recommended Celltrion's antibody therapy, Recurona. What are the implications of this vote of confidence from Europe's drug regulator?
Well, it signifies their recognition of legitimacy of the efficacy of this particular treatment regimen. I think it'll be beneficial both to the country that starts to use it and also to the company in Korea as well. The fact that they have another tool at hand to really approach the patients before they become severe in their progress it'll be very much of a high benefit to the countries that start to use it, but also at the same time as the exporting country, we would also benefit from the sales of it. Now, from the clinical point of view, though, is that it's still an IV drug, so it has to be applied to patients who are in a situation inside the hospital being admitted to receive the IV, as opposed to the oral regimens that are bound to be hit the market pretty soon. So I guess in a sense that we have to sort of protocol or come up with a protocol so that before the oral regimens become available, we would be able to actually use these products to the appropriate people. That's one of the homeworks that I guess both the countries and the company has to do currently.
Right, and staying with Celltrion's Recurona, Jan, I hear the approval process for this antibody therapy has been proceeding at a prompt pace there. Could you tell us more?
Yeah, this gives us hope. The European Medicines Agency has paved the way for approval of this medicament, Recurona. And now it is up to the EU Commission to give the final decision. But you can assume that this would be only a formal decision, that it will be approved soon. This is a good perspective because I think it's very important to have a variety of therapies fighting this virus.
Right, of course. All right, Jan, as always, thank you very much for the latest from your part of the world at this hour.
I thank you, Sunny.
Right, now Dr. Kim, do tell us a bit more about the effectiveness and safety of Celltrion's Recurona.
Well, in terms of effectiveness, like some monoclonal antibody that was already just approved in the U.S., its efficacy is about just 70 or 80% effective in just preventing progression to the severe COVID-19. That was actually true for other monoclonal antibodies like Eli Lilly, Regeneron, and then Vir Biotechnology, and then GSK. That's actually the same. And but this drug has to be used for the early just a viral replication phase, not in the later just inflammatory phase. And and in terms of safety, this is an antibody. So antibody is something that is actually just already circulating in our body. So this is kind of a protein. So in terms of safety, it is good. But early in the pandemic, there was some concern, and even in just the monoclonal antibodies and then the vaccine, because there's some earlier reports about some sort of it is so-called antibody-dependent enhancement. That's actually very well-known effect in some dengue infection. For the dengue infection, the primary infection does not make some serious problem, but in the secondary infection, especially with some different genotype of antibody, the genotype of virus, that the presence of the prior antibodies raised by the primary infection, that actually enhances the secondary infection. Enhances secondary infection and also exacerbates the disease. This kind of very similar kind of effect was also observed in some SARS-CoV-1 infection, at least some experimental setting. So earlier concern was whether this kind of antibody-dependent enhancement would be observed in some SARS-CoV-2. But in the end, we did not observe such kind of thing. So basically, this was the most severe concern, but now this is resolved. So in terms of safety, I think this is okay. And well, the safety and safety and the efficacy is pretty good. So as Dr. Kwok said, since we have these monoclonal antibodies in our hands, I think we have to use more just widely. I mean, widely. We have to cover many more just patients, not just some small group of patients. So then we can ultimately just decrease the number of just severe just COVID-19 cases. So that's the case. So and ultimately just oral antiviral would play just a major role because those kind of just antiviral would be just administered at the outpatient setting. This is very important, especially in the some pandemic situation. But still, just monoclonal antibodies. This is the one we have right now. So this can be very usefully just employed right now.
Right. And Professor Kwok, Moderna has acknowledged that its vaccine does indeed pose a greater risk of myocarditis compared to other vaccines, especially for those under the age of 30. Do you believe there needs to be a shift in Korea's offer of Moderna vaccines, that is?
Mm-hmm. Well, there's actually two sides to this picture or story. So it was shown that Moderna actually is showing about 5 times more of the myocarditis happening in people who are under 30 years of age, and those happen to be male. But also at the same time, Moderna shows probably the littlest breakthrough infection rate compared among the different types of vaccinations. So two different benefit and ratio risk that we have to sort of calculate. I think it's a homework that government has to currently come up with the results for, but at least for the time being, even the myocarditis happening are quite mild in clinical cases. So not currently, I don't think the government is going to stop the usage in even younger generations, but they would definitely have to look into this more thoroughly and possibly decide whether or not to still further ahead use the Moderna shots for people who are under age of 30.
Right. All right, Professor Kwok, as always, thank you very much for your insights. And Dr. Kim, thank you very much for your thoughts and time.